Hi, I'm Peg Luksik, candidate for U.S. Senate from the state of Pennsylvania, and this is part 2 of our analysis of House Bill 3962, Nancy Pelosi's health care bill. Question 4, can I still buy private insurance? Section 202 of the bill addresses that point. It's called Protecting the Choice to Keep Current Coverage. If you already have coverage, you can keep what you have. It's called a grandfathered policy. But the health insurance issuer cannot add anyone else to the policy after this bill is passed. That means if your employer hires someone new, that new person cannot be added to the employer's policy. The policy that you have cannot be changed in any way. So when the policy comes up for renewal, which is usually annually, not one thing in that policy can be changed or you will lose it completely. That includes adding new benefits or changing the cost-sharing structure. This situation lasts for 5 years. After that, every health insurance policy must be the same as the federal policy. The language in the bill says that every health insurance policy must meet the same requirements as apply to a qualified health benefits plan. If the policy is not grandfathered, or if it stops meeting the requirements of being considered grandfathered, then it can only be offered as an exchange participating health benefits plan. That's the government plan. So either way, everyone eventually winds up with the government plan. Question 5, how are private insurance providers affected? The bill adds a number of new mandates to private health insurance providers. The first one is a new requirement contained in Section 104 that shall require health insurance issuers to submit a justification for any premium increases to the federal government prior to implementation of the increase. To understand why that's important, it's necessary to know that when the government cuts their reimbursements to programs like Medicare, the hospitals and doctors have to recoup the lost income. The cost of providing health care doesn't magically drop just because the government decides to balance its budget by cutting payments for health care services. So the health care providers went to the private insurance agencies and renegotiated their fees to a higher level for providing services to people who had private insurance. That's part of why your premiums went up. The insurance company passed the costs along to you because that was the only place to put it. It's like an invisible tax increase through rising premium rates on people who were paying for private insurance, whether that was you or your employer. Now the same government is saying that the private insurance providers are not going to be allowed to increase their premiums without the government's permission. It's a pressure cooker that business and private insurers will be caught in the middle. It will either drive the private insurers out of business because they can't pay the higher fees to hospitals and doctors without raising premiums to cover them, or it will drive the hospitals and doctors into rationing care because they can't get the payments they need to provide those services. The second requirement is a new definition of qualified child. That's in Section 2703. According to this language, a person up to 27 years of age will be considered a dependent under their parents' policy, with coverage provided at rates and benefits for children under a family policy. This turns young adults into children for premium rates, putting even further financial pressure on private insurance companies. Third is a limitation on consideration of pre-existing conditions. This is in Section 106. It's followed by a total prohibition on consideration of pre-existing conditions, spelled out in Section 211, which not only prohibits exclusion of pre-existing conditions, but forbids the insurance provider from imposing any limit or condition on the coverage they provide. This is joined by Section 716 that forbids insurance providers from imposing a lifetime dollar limit on any benefits. Now, remember, no insurance provider can raise their premiums without government approval. So where do they get the money to pay for all the additional benefits of you're a child until you're 27, we can't consider pre-existing conditions, we can't put a lifetime cap on any benefits, and we have to pay for all of that from where? That creates a situation that is impossible for private insurance providers, and the government's still not done. Fourth is a provision in Section 717 that says that every health plan shall contain a provision that expressly bars the plan from reducing benefits to a retired participant, even if the plan had language that allowed it to amend or terminate coverage. This includes forbidding a raising of premiums on retired individuals. So what happens if there's no money to cover those benefits? Well, the plan can apply to the government for reimbursement of its cost. They can get up to 80% of costs, and there's a dollar cap on top of that. The government will decide what claims get paid for what people at what level. That takes us back to government control of who gets what health care under what conditions, this time for retirees. The last provision on this topic that we're going to mention today is contained in Section 1802, the Comparative Effectiveness Research Trust Fund, and how you finance the trust fund. This section creates a new federal bureaucracy and funds it from the Treasury for 3 years. After that, it is to receive $375 million every year. Where does the money come from? The answer to that is in Section 4375, which says, there is hereby imposed on each specified health insurance policy for each policy year a fee equal to the fair share per capita amount multiplied by the average number of lives covered under this policy. Specified insurance policy is any accident or health insurance policy issued with respect to any individual residing in the United States. What does this mean? It means that the federal government will divide the total appropriation of $375 million by the number of people who have private insurance to calculate a fair share fee. Then they will bill the insurance company by multiplying the number of people that they insure by that fee. This is a new tax on health insurance to fund a new federal bureaucracy. And as the number of people covered under private insurance goes down, the fee goes up, since the $375 million total remains the same. In a multiplication problem, if the total remains the same and one factor goes down, the other factor has to go up. So it's an increasing tax on health care on people who continue to have private insurance. Coming up in part 3, it will be a discussion of some of the bureaucracies the government is creating and how you as an individual wind up paying for this coverage.